Abusia Gunja de Shekron a wati jata ngoma sojo press no rede Ghana Mampani His Excellency John Dramani Mahama and our and convoy eto so ba no ne ha Kempinski na ene day no World Health Organization wo mo Health Expo koso wa ha den na me gidi se obi sasa na adan Ghana Mampani o wa yire dura na because na watwetwe mu ye mu na wogopie mu wo kata Doha na wɔkɔ di ne nkui wɔ hɔ afei deɛ ɛkɔdu anwummerɛ ne yɛhwɛ n'anim a ɔpani asa kɔpie mu Côte d'Ivoire ɛkɔyɛ swearing in wobɛduru nnura anadwo na ɛnnɛ anɔpa ɔpani anna wasan sɔre abɛpie mu wɔ ha ɛsɛ wɔbɛbɔ adwuma de ama ɔman Ghana ɛwɔ sɛ Ghana Mampani yɛhwɛ na yɛma no kɔ na ahomegye mu kɔ home bɛɛ na ɔtwe mmienu kɔ bosome ɔde dwodwo no ho because menyini sɛ ne mma no koraa ɔmo enjoy mo papa saa sɛ yɛyɛ na ɔpani ɔkɔ adwuma no nso de wɔbɔ na ene da yi wabepie mu wɔ ha na ohwɛ a santen a wato wɔ ne Ghana ye Minister of Health ye Rakwabena Minta Kando abepie mu wɔ ha na ha Ghana News Series so ene de kan aba ohwɛ me a ma subscribe na wa share de ama me. Abusuanti Ghana National Anthem na wɔn abo a yɛte awie na yɛntie ɔmampani sɛnea wɔse nsɛm no ɛwɔ ɛha no abusua saa nso na mesrɛ sɛ ne ndi kan aba ahwɛ me na wa subscribe na wa share video de ama me bɔ mmɔden nso na download lemfa yɛ nim ya wo send this ka fia ma no ne bɔ ɔman Ghana mu a wobɛnya 1% of sika wo send yɛ nti fa saa akonya so na enjoy bɔ news hyem na wanya saa akonya no.
Remembered my lessons in social anthropology when I did history in university. And it said that because of the savannah, which is flat and has open spaces, dances from the north are very vigorous with a lot of jumping and, they have enough space. And then dances from the forest area are very limited in movement like Adoa, and they insist more on grace than on vigor, And so let me thank the dance ensemble for that beautiful performance. I'm happy to be with you. Indeed, I had to travel miles to get here, from Doha to Abidjan, and arrived yesterday evening just to be on time for this all-important conference. And after the minister spoke, I did realize that it's true. I've attended more health-related events than any other sector. It shows how important healthcare is, in terms of the welfare of our people. I've been having a few thoughts. When I was vice president and under my boss, Professor John Mills of blessed memory, we realized that a lot of the diagnostics equipment in most of our healthcare facilities were non-functional. And so we decided to do a major retooling of all our hospitals. And so we installed MRI machines, CT scan machines, X-ray machines, re-equipped our laboratories. I mean, it was a major retooling exercise. It cost us in excess of $250 million. And of course, our assumption was that we had brought our healthcare back up to scratch. I'm saying this because I realized that PPPs are not optional anymore. They are a must. And I'll tell you why. Several years later, I reincarnate as the president again. I was sworn in January. And we launched the Ghana Medical Trust Fund, which is called Mahama Cares. And just 2 weeks ago, the board and leadership of Mahama Cares came to brief me on the operationalization of the fund. Finance Minister was very generous. He allocated to the fund 2.1 billion cedis, and that is over $200 million, because we realized that our major cause of morbidity today is non-communicable diseases. Non-communicable diseases account for more than 45% of Ghana's morbidity. And because of our changing lifestyle, cancers, cardiac incidents, high blood pressure, diabetes, liver failures, kidney failures have become very common. And so they came to meet me and said, I mean, we have the money to start, to pay claims and, enroll people on the program. But Mr. President, there's a major problem. Yes, what's the problem? There are no diagnostics equipments, MRIs are broken down, CT scans are broken down. There's limited cancer treatment outside Accra and Kumasi, which are our two major cities. And so it's not about the availability of the money to help to pay the high cost of treatment, but even the equipment, both to diagnose and treat, are in limited supply. Indeed, there's the example of one particular hospital which we built 9 years ago. I came back as president to find that not one single of their equipment is working. No CT scan is not working. If they have to do a CT scan, they have to put you in an ambulance, take you to a private facility, do the CT scan and bring the report back. If they have to do an MRI, they have to take you out and do it and bring you back. I mean, all the advanced equipment we put in that, model of a hospital are all broken down. And so, obviously, it shows that the private sector is better at delivering and maintaining those services than the government sector. And so we spoke with the Ghana Medical Trust Fund, and I said, it's not acceptable that you live or die depending on which part of Ghana you live in. If you live in the north and you have a cancer, you either have to move your whole family physically and come and live in Accra or Kumasi to be able to get cancer treatment. If you live in some part of the country and you have to do dialysis, and I have the example of one of my assemblymen who died. He was an assemblyman when I was member of parliament, and he had to do dialysis twice a week. He had to move his family, rent a place in Kumasi to be able to do the dialysis, twice a week. Eventually, by the time he died, he left his family impoverished. He sold his house, he sold his car, he sold all his property and died. And he left his family very impoverished. And so it's a big challenge we face, and it behoves on us as leaders to ensure that we spread medical care so that wherever you are geographically in our countries, you can be sure that you get a certain standard of quality care. And we can only do that if we combine forces with the private sector. And so what I told the Mahama Cares, the Medical Trust Fund is otherwise called Mahama Cares, named after me. So what I told them was, look, we're going to put money into diagnostics and treatment facilities, but we'll only do it if we do it in conjunction with the private sector. We're not going to repeat the mistake we made and put all those expensive equipment in government hospitals only to come back 5, 6, 7 years later and all that equipment is not working. And so the private sector, this is the opportunity to partner with government to make sure that we have universal health care in Ghana, but I think that Ghana faces similar problems like many of our other African countries. And so this is an example from our country, but I think that it applies in many other areas. It's normal for me to do something like that. After that, I have a speech that I'll inflict on you. Mercifully, it's short. Mercifully, the speech is short, and so I'll be out of your faces in a short while. And so on behalf of the government and people of the Republic of Ghana, I am honored to welcome you to Accra, a city of ideas and courage and a meeting point for continental renewal. Today, we gather for the second edition of the WHX Leaders Africa Summit under the resonant theme, Catalyzing Africa's Health Revolution Through Investment, Innovation, Impact, and Infrastructure. This summit is not merely an event on our calendar, it is a defining continental moment, a moment when Africa asserts its rightful place in the global health architecture, and when we recommit ourselves to building a future in which our own agency shapes our health security, scientific leadership, and health economies. We meet at a time of profound global shifts. Health systems are being redesigned, supply chains are being rewired, and new geopolitical realities are forcing every region to rethink the issue of resilience. These transformations present both a challenge and an opportunity. But the truth is simple. Africa cannot afford to be a bystander. Africa must be a participant. Across our continent, a new generation of innovators and entrepreneurs is emerging. We see advances in biotechnology, digital health, vaccine research, and medical manufacturing. We see the massive potential of the African Continental Free Trade Area, the world's largest free trade area by population, opening a new frontier for health markets and industrial expansion. Yet our vulnerabilities remain visible. We have persistence and inequities, fragile supply chains, limited manufacturing capacity, and insufficient investment in primary health care and emergency preparedness. COVID-19 exposed these weaknesses dramatically, reminding us that in moments of global crisis, Africa often is the last to receive support. Those experiences taught us a hard lesson, that no continent is safe until every continent is safe. But they also illuminated Africa's path towards, they also eliminated Africa's path forward, a path that is defined by health sovereignty, not in isolation, but in partnership that respects African priorities, African leadership, and African expertise. Health sovereignty means aligning global assistance with country-led strategies, empowering the Africa CDC, AMA, and regional regulators, building capacity to manufacture vaccines, medicines, diagnostics, and health technologies on African soil, strengthening surveillance and early warning systems and emergency preparedness, investing in Africa's health workforce, the backbone of our systems. These priorities align squarely with Agenda 2063, the Africa CDC, New Public Health Order, and global commitments under SDG 3. Our task now is to move from ambition to execution. Ghana is proud to contribute to this continental transformation through 3 interconnected initiatives. And the first one is the Ghana Medical Trust Fund I was talking to you about. The Ghana Medical Trust Fund program is our flagship national mechanism for sustainably financing specialized and high-cost medical treatment, including cancers, dialysis, advanced surgeries, and chronic disease management. Too many families have suffered financial devastation from these diseases. Mahama Care seeks to break that cycle. It positions Ghana as a regional hub for specialized care, advanced research, and cutting-edge innovation. To complement this, we also, that is the second initiative, will implement a universal free primary health care program, ensuring that cost never prevents any Ghanaian from receiving essential care. This initiative strengthens community health systems, expands digital health services, and shifts our health model decisively towards prevention, early detection, and community-driven care. And the next is retooling and modernizing health facilities. Our ambition requires a strong modern infrastructure base. We're committed to, under a PPP, retooling our health facilities, and this includes with modern imaging and diagnostic systems, upgraded laboratories, strengthened dialysis services, biomedical engineering reforms, and resilient smart supply chains. Crucially, Ghana is inviting private sector partners, and this is what I was talking about, into strategic PPPs to expand diagnostic imaging, laboratory network, and specialized services nationwide. These three pillars are not isolated programs. They form the backbone of Ghana's health transformation agenda and our contribution to the broader African sovereign health ecosystem. Your Excellencies, ladies and gentlemen, Africa seeks a new paradigm of partnership, one that is defined not by dependency, but by co-investment, innovation, and shared values. So we call on vaccine manufacturers to partner with us to build African vaccine production hubs. We call on pharmaceutical companies to expand into biologics, generics, and essential medicine manufacturing in Africa. Diagnostics, innovators, biotech firms, and medical device producers to establish assembly plants, R&D centers, and fabrication facilities here in Africa. And DFIs, private equity firms, venture capital, and philanthropies to co-finance Africa's health industrialization. The conditions have never been more favorable. The African Continental Free Trade Area offers a unified market of about 1.3 billion. A growing innovation ecosystem is ready for acceleration. The African Medicines Agency is strengthening regulatory harmony. And most importantly, political will across the continent is very strong and aligned. And so the table is set. The opportunity is enormous, and the moment is now. To our doctors, nurses, midwives, pharmacists, scientists, allied health professionals, and community health workers, this new era is yours. Your dedication, resilience, and brilliance sustain our nation. And to our young African innovators, our AI developers, medtech creators, and digital health entrepreneurs, the future of African healthcare will be shaped by your imagination and your ingenuity. We're building this new health order with you and for you. A healthier Africa will be a more prosperous Africa. A more resilient Africa will strengthen global security, not hurt it. A more innovative Africa will enrich the global health ecosystem. We have the vision, we have the talents, we have the determination. What remains is to forge the partnerships that believe, as we do, that Africa's rise is integral to global progress, and that Africa is not in contest with anyone. And so let this summit be remembered not for discussions, but for commitments that come out of it. Not for intentions, but for investments. Not for aspirations, but for implementation. Let the partnerships that are birthed here be bold and think out of the box. Let the agreements reached here be transformative. And let our decisions echo through generations and generations to come. And so it's with pride and optimism, and it's my honor and privilege to declare the WHX Leaders Africa 2025 Summit officially open. Thank you, and may God bless Africa. Thank you.
So send this cafe amanoni aba Africa ha Usulem fi say ye fear wo pese wo nto no Usulem fi edan anansa japade a wani da so a wo pese oto wa Africa ha no Usulem fi say wo send this sika ama odofo e de aboa no wo Africa ha Usulem fi sanso e na say wo tie obi school fees ama no a Usulem fi nyenti a make kamfo lem fi ama on say utimi send this sika e fa lem fi so a e ma ne begu wo bank account mu sanso e na timi begu wo mobile money account mu eno achi nso no de bia lemfi e wo daily rate a e ma hu sika dodo a wo sende a wo benya lemfi e ye secured na wo send this car enche na nipa a wo sende ama no ne nsa aka lemfi wo USA Canada UK Italy Germany Ireland Netherlands Spain Belgium Portugal and France wo de lemfi send this car untu ahwe bomodian dey use me code NEWS news na say ene any day dikan a register or lemfi so a unya bonus sanso na use chance so a ye wo bonuses ahodo a ye de ma.
Honorable ministers and government leaders, captains of industry and global investors, innovators, scientists, health champions, esteemed delegates, ladies and gentlemen, it is a great honor to welcome you to Accra for the WHX Leaders Africa 2025 Summit, Akwaba. This gathering is more than an annual event. It is a call to forge meaningful alliances and accelerate the emergence of world-class resilient healthcare systems across the continent. WHS has become a platform where ambition is converted into action and where Africa's vision for health sovereignty gains clarity, strength, and direction. Over these 2 days, we are not here simply to talk about the future, we are here to build it. Your Excellency, for too long, Africa's health narrative was framed by scarcity. Yet, the Africa of today, and even more so, the Africa we are shaping, demands a story rooted in possibility and capacity. By 2050, our continent will be home to 2.5 billion people, the youngest and most dynamic population anywhere in the world. The demographic force is not a burden, but a powerful competitive advantage that must be matched with the bold reforms and strategic investments. If we act decisively, Africa will not merely catch up with other regions, Africa will lead. WHS is a catalyst to accelerate that leadership. Ladies and gentlemen, a critical pillar of this transformation is our ability to produce the essential tools of healthcare. No continent can be sovereign whilst importing most of its medicines and nearly all its vaccines. To lead in 2050, Africa must invest in regional manufacturing hubs, strengthen pharmaceutical and medical device production, harmonize regulatory systems, and build strong public-private partnerships that accelerate technology transfer. Ghana's growing vaccine manufacturing capacities and regulatory reforms reflect our readiness to drive this continental agenda. Yet, even the strongest national vision cannot succeed without partnerships. Health sovereignty is not about working alone. It's about leading a collective effort. It requires development partners to align with Africa's priorities, not to create parallel systems. It requires regional integration, shared procurement, coordinated surveillance, pooled supply chains, and harmonized regulation. It requires partners who are willing to move beyond traditional assistance towards long-term, mutually reinforcing collaboration. When partnerships are aligned with African vision, they amplify our strength. When they are not, they dilute it. Your Excellency, at the foundation of our national transformation is primary health care. Ghana's free primary health care program, distinct from the Ghana Medical Trust Fund, removes financial barriers at the point of care and strengthens community-level delivery. It gives every Ghanaian a fair chance at early detection, disease prevention, and timely intervention. Supported by digital tools and AI-enabled diagnostics, it reflects our conviction that health is a right and not a privilege. Complementing this is the Ghana Medical Trust Fund, which secures advanced care such as oncology, dialysis, complex surgeries, and specialized diagnostics. Together, these two instruments create a balanced, future-ready system capable of delivering equitable access and specialized excellence. Distinguished delegates, at this stage of our development, digital innovation has become the driving force behind our transformation. We are building a centralized national health intelligence database that will allow our real-time data analytics, greater transparency, and truly evidence-based decision-making at every level of the health system. To support this, we are developing a national middleware layer onto which all digital health platforms will be integrated. This ensures interoperability, national ownership of all data generated, and the ability to use that data to improve the lives of our people. This digital shift is strengthening governance, improving operational efficiency, and making our health system more responsive to the needs of our citizens. It is enabling us to track disease faster, allocate resources more efficiently, and hold ourselves accountable to higher standards of performance and transparency. Digital transformation is not an accessory to our reforms. It is the backbone of a modern sovereignty and people-centered health system. Preparing Africa for 2050 also requires modernizing our hospitals. Ghana is implementing a national retooling program that upgrades diagnostics imaging, strengthens laboratory and pathology services, expands dialysis capacity, and integrates digital systems that support rapid clinical decision-making. These investments transform our hospitals into modern centers of excellence and position us to confront both current disease burdens and emerging trends with precision and speed. Distinguished ladies and gentlemen, if Africa embraces bold action and collective effort, the continent that emerges in 2050 will be profoundly different. Africa will be a global hub for pharmaceutical and vaccine production. Our hospitals will be digitally connected and AI-enabled. African researchers and entrepreneurs will shape global science. Our financing scheme systems will support universal access. And Africa will take its rightful place as a leader in global health governance. But to reach this future, partnership is not optional, it is indispensable. This summit must therefore produce outcomes that endure. Government must demonstrate clarity and courage. Investors must recognize that Africa is not a peripheral opportunity, but the world's most promising health frontier. Innovators and the youth must drive solutions that stretch the boundaries of possibility. Development partners must do more than support Africa. They must stand with Africa, align with Africa, and invest in Africa on African terms. Your Excellency, in conclusion, we call for partnerships that are respectful, strategic, and transformative. Partnerships that build institutions, not bypass them. Partnerships that strengthen local capacity, not replace it. Partnerships that deliver value to all parties, not just one side. Partnerships that see Africa not as a recipient, but as a co-architect of global health. Africa is ready for such partnerships. Indeed, Africa deserves such partnerships. Let this summit be remembered as a moment Africa chose ambition over caution and unity over fragmentation. Let it be the moment when government, investors, innovators, and development partners agreed that Africa's future will be shaped through shared effort and shared responsibility. Africa's ascent begins now. Together, let us build a healthier, stronger, more sovereign continent, one fully capable of leading the world into a new era of global health experience. I'm most grateful for the opportunity.
Dramani Mahama, President of the Republic of Ghana, thank you so much for your presence this morning. Excellencies, distinguished guests, colleagues and friends, good morning, Akwama. It is a profound honor to welcome you to WHX Leaders Ghana. This exclusive invitation-only gathering is not simply an assembly of expertise, it is a call to action. WHX Leaders represents a bold, collective ambition to accelerate the transformation of Africa's health systems through deeper partnership between government, industry, and healthcare leadership. By convening ministers, senior public sector decision-makers, private sector trailblazers, and C-suite executives, we are aiming to create a powerful platform, one capable of shaping investment priorities, informing policy pathways, and unlocking scalable, sustainable solutions that can improve millions of lives. This is where ideas meet influence and where influence becomes impact. We are extremely honored and privileged to hold this event under the distinguished patronage of His Excellency John Dramani Mahama, whose steadfast commitment to strengthening Africa's health landscape continues to inspire courageous, future-focused leadership across the continent. At Informa Markets, our purpose is clear: to connect people, to enable progress, and to help drive meaningful transformation. Your presence here today reflects the trust that you have placed in us, and we embrace that responsibility with conviction. We are committed to ensuring that WHX Leaders is not only insightful, but truly catalytic, a platform that sparks new alliances, amplifies local and regional ambitions, and accelerates the momentum that Ghana and Africa truly deserve. Thank you all for being here. I look forward to the conversations, commitments, and concrete actions that will emerge from this room. Actions that will shape a stronger, healthier future for Africa. Thank you very much.
So send this cafe amanoni aba Africa ha, Usulemfi. Say ye fear wo pese wo ntono, Usulemfi. Edan ya na se japade a wani da so a wo pese oto Africa ha no, Usulemfi. Se wo send this sika ama odofo e de aboa no wo Africa ha, Usulemfi. Sanso e na se uti obi school fees ama no a, Usulemfi. Nyenti a me kanfo lemfi ama one se utimi send this sika e fa lemfi so a e ma ne begu bank account mu. Sanso e na timi begu mobile money account mu. Eno achi nso no de bia lemfi e wo daily rate a e ma hu sika dodo a wo send a wo benya. Lemfi e secured na wo send this sika enche na nipa a wo send ama no ne nsaka. Lemfi wo USA, Canada, UK, Italy, Germany, Ireland, Netherlands, Spain, Belgium, Portugal, and France. What the Lemfi send this sika untu ahwe. Bomodi ade use me code NEWS news. Na say ene any day they can register or Lemfi so a unya bonus. Sanso e na use chance so a ye wo bonuses ahodo a ye de ma.
Menu makwekwe sa sempa kania. Se menam na meti asempa na mo amane a na ma no keka me. Anyem bia what ANS Trading Agency Limited nka. Se wo ka se door to door for no de na e watwa. Esanse obie ne wa wo se wo ho sa door to door business nim. Wo nneoma wo UK a wo de ko Ghana. Ana se Germany a wo de ko Ghana. 3 to 5 weeks e bekwa kodu nipa ne puno anu se try. Na de mo demonstration ko wo se adwuma de ewe mu ne se wo ho bo no. E da fom se boko. ANS Trading Agency Limited. E wo air freight special service. Ana nneoma ne ye de befa plane. Entintempa na akwa kodu. Obetima fasa plan we also the nneoma free Ghana, akwa UK and Germany. FGG dem, which na also agina ye, na men drop bomb. ANS Trading Agency Limited pe, and a 40-footer and 20-footer container. Yefe UK, ediko Ghana, and Germany, ediko Ghana. Oma manuoma yemre, importo, exporto, them there for you. Omo Ghana na money 0249 170 423. UK has over free 0790 802 7527. Germany 09173 771 2733. Wobenya A&S Trading Agency Limited. Our West Croydon. A&S Trading Agency Limited. Quantum Brantem. Wana bebo ya baso. Maybe next time in your fill up from the bebro.